welcome to all of you who are at the International Conference Against Sexual Violence. My name is Pragathi, Tummala, and I'm the Executive Director of Pragathi. I'm sorry I couldn't be with you today live. I am based in Denver in the United States, and I welcome you to send me any questions or comments you have after my brief presentation today on networking and how it impacts people working in the field of prevention of sexual violence. So thank you for having me to our Incest Trauma Center partner in Belgrade. I'm glad to be with you today. So I'm going to get started on my presentation and again, enjoy your time networking there in person, and I wish I could be there with you. So as we talk about the communities of learning for professionals who work in the field of prevention of sexual violence, I do want to just share with you some of my thoughts about why this is so beneficial and how I think there's a lot of value in creating these networks. So quickly, just to review, for us at ISPCAN, we focus on child abuse and neglect. But I think the same principles apply across all forms of sexual violence to whomever is the victim. But many times it's not just sexual abuse we're talking about, it's accompanied with other types of abuse. So it is important for professionals to be prepared and well-versed in recognizing the signs and symptoms also of physical abuse, emotional abuse, and neglect, which often accompanies sexual abuse. The prevalence and cost of child sexual abuse, this is just an example in the United States. I don't think it's disputable. It's very clear, the evidence is there for how women, men are all affected. And the estimated cost over a lifetime for rape, which might be eye-opening for you to know that it's around $122,000 per victim. Sexual violence programs really need to have many elements in order to be effective. Here we have listed some of the main elements in programs that require us to promote social norms that prevent against violence, to teach the skills to prevent sexual violence, as well as provide opportunities to empower women and girls, put resources into creating protective environments, as well as offering victims and survivors support and treatment, which is where many of our professionals focus. But this diagram kind of gives us the idea as to why it's so important to network and have cross-disciplinary connections in the field, because it's really essential that we create programs that effectively target all of these areas when we talk about sexual violence. Social determinants of health are kind of a public health perspective as to all those things that impact health outcomes, everything from our economic stability, neighborhoods, education, access to community and the social context, as well as healthcare systems and our abilities for providers to have access to the latest information, how our healthcare system works, as well as the quality of care. All of these things do become factors, and again, speaks to the need for why networks are so important. When we look at the public health network, this is a general diagram with a lot of US terminology, but it is, I think, a good example as to why we cannot work in our own bubble, whether it's doctors or schools, mental health providers. All of us are connected and required part of prevention and treatment of sexual violence. So it is really critical that these networks and connections exist between these disciplines. Public health services are somewhat defined in a cyclical fashion in that there's a part that is about assessment, monitoring and diagnosing the actual health effect, as well as creating policies to prevent and treat sexual violence appropriately, which then lead to us creating laws and making sure our workforce is competent to provide the services needed, and then having data systems available to us for us to evaluate how effective our programs are, and then they continue to go in the cycle of improvement. So again, you can imagine how networks and connecting all these different areas and ways that we work are so critical. When we think about professional networking, we can think of that as kind of circles. We have first the local level of connection in these communities of learning that can then grow to the regional and international levels. These allow us to unify multidisciplinary professionals. It allows people to stay on top of the latest data and research, treatment tools, prevention materials, because many times professionals are busy all day treating patients for 6 hours a day. Many of us don't have time to come up and look for reading our journals, staying on top of the latest trends and research and reports. How do you know which ones are really good? So it's very cost effective to create these networks that allow us to share the best materials and resources. The networking is also key because the relationships we build amongst our peers allow us to develop camaraderie. It prevents burnout in this sector of work that is very traumatizing, I think, for the providers as well, who become emotionally affected by their patients. So this support and learning really helps these small sectors of specialists, especially working in fields like child abuse or sexual abuse prevention. It can be isolating. I would like to give you an example of one of the working groups we've established at ISPCAN, which many times these networks can be established by discipline or topic, or it could be maybe by region. So say you live in a particular part of the world and you want to connect with other people in Africa, you could potentially connect by region. But if you are interested in connecting by discipline or topic, we have an example of one through ISPCAN that you can see that allows people to connect through their interest in sexual victimization and exploitation. So when we look at this page, there's an interesting way that you can connect. The purpose is laid out for the working group. The goals for the working group are laid out, who the convener is. It allows us to be able to share the key reports and research in the field. And then it allows people for it to be a two-way street, so others can contribute to the discussion by sharing their own articles and research, as well as data sources. And this is the forum by which you can share a topic or interesting report. But we have it set up so that you can subscribe to updates and see what is happening in the field. So this is just one example of how we utilize our networks to stay connected to professionals all over the world. So I'm going to keep going here. And the networks are incredibly important for people who are locally sometimes isolated, to be able to see that across the globe you might find other people working in the field who have similar issues or similar situations, and you can share and learn from one another so that you're not all starting from ground zero. It's an opportunity to share best practices. It allows people to not reinvent the wheel. Time and resources are precious, and sexual violence and treatment and abuse, these are not well-funded areas. So it also gives people the chance to reach out and connect, to maybe co-apply for grants or projects that where we can complement each other in what we can bring to the effort, and it allows us to be more competitive in applying for grants or to foundations to do specialized work in the field of sexual abuse. I think the other interesting thing is that we can have grand rounds. The networks can be used to even share case studies of situations that of child trafficking that come up. It allows people to develop policies and training materials that are very costly and difficult to create in one country, but if you can share with another community what you have learned, and so that the same mistakes will not be repeated, or that you have a better answer to some of the challenges that that might commonly face everyone, that sharing and relationship building can be really great for programs. So when you're thinking about setting up networking, I think you just have to be mindful of what the purpose is, the logistics involved in terms of how you're going to meet and share, whether it's online or in person, understanding the different responsibilities involved there. We utilize a lot of online cloud-based sharing libraries like Dropbox, so that we can share documents and have one place to kind of bring all the information together in one place. But it is a really big time commitment, so the people who take on establishing networks really need to be realistic about how much time it's going to take and how often they want to communicate, and have some leadership that helps set the time and accountability for the network. But the benefits are enormous. I think any of us who have been involved in networks understand that it's a great place to take materials maybe that are in English and be able to translate them into Spanish or Arabic, and not have to recreate all the educational materials from scratch. This applies to data tools, etc. And even prevention campaigns, which many times are very costly to create, but can be translated and shared and used because the themes and the topics are the same, regardless of what culture you're working within. And on the personal side, we talked a little bit about the benefits of networking, just because the work in this field is very intense and people get burned out. So those relationships really are, I think, uplifting for people working in this area. So I do think the other opportunity to build sponsorships and help to find funding that could be a good source of income for your organization is also something that you can share in networks, along with jobs and fellowship opportunities for specialized training. So I just want to end with a couple of thoughts about learning, because once we leave school, university, graduate school, there isn't a great opportunity to continue learning unless you do belong to a network or an association that helps you to continue to receive postgraduate information. And it's a great way to remember that you are not alone struggling through whatever work you're doing, or sometimes the restrictions of the funding or the politics in your region. But the local networks really help us to connect the disciplines that work together to make our work more focused on the victim-centered, so that the police coordinate with the doctors, who coordinate with the lawyers, and essentially make sure that the services are more patient-centered. The regional networks and the next level of circle do help us to understand that whether it's in Serbia or in the Czech Republic, there are some things that might be culturally shared amongst both countries and can be utilized to the best benefit of both, and that the same mistakes don't have to be made again and again. And again, international networks like ISPACAN, we do work to promote country-to-country sharing of best practices and systems of care, which I think it's always wonderful to know that you can lift up out of your vantage point to see the bigger picture and know that other people are struggling with similar issues. So in the end, I just want to conclude by saying thank you for your time and attention. I think networks are a critical part of professional communities, and ISPACAN is only one type of organization. We are international, and if you would like to learn more about us, you can find us at www.ispacan.org. And then if you have any comments or questions, please don't hesitate to contact me at execdirector@ispacan.org. So thank you all very much for your time and attention today. I wish you the best of luck and to enjoy this conference to the fullest. So Sorry I could not be with you today, but all the best. Thank you. Goodbye.